Well, Ontario will begin to gradually reopen this Monday, and the Chief Medical Officer of Health says it is now up to us to assess our own risk and live with it. He's essentially telling everyone to govern themselves based on what risk level they can handle.
We can't eliminate this threat. In fact, we have to learn to live with it. We have to learn as a society to live with this virus, to live with the risk wherever we're going in our community.
So when Ontario begins a phased-in reopening this Monday, restaurants, gyms and bars will be able to open at 50% capacity. And, this is new, while proof of vaccination is still required, they will no longer have to collect customer info for contact tracing.
The amount of virus in the community is not such that individual case and contact management will have any benefit. I think on an individual level, you have to identify your risks. You have to monitor your symptoms.
Movie theaters, arenas, and concert venues can also reopen at 50% capacity with a cap of 500. Initially, the province said food and drinks could not be served in these settings, but it has now changed the rules. So popcorn is a go again if you go see a flick, and so is a beer and snacks at a game. But masks are mandatory unless you are seated and eating. People didn't always follow those rules before venues were closed. As of Monday, indoor social gathering limits will increase from 5 to 10, with 25 outdoors. The easing of restrictions is welcome news for Mississauga Mayor Bonnie Crombie.
Restaurants and gyms in Mississauga have faced longer closures than anywhere else in North America. This needs to be the last lockdown we see on businesses here in Mississauga.
While everyone is done with COVID, it's not done yet. With 1,036 deaths since 2022 began, this January is turning out to be the deadliest month in a year and one of the deadliest in the entire pandemic. Dr. Moore believes February will continue to be difficult, but things will improve in March.
I do believe we're cresting and have reached a peak.
Also this Monday, the government will begin phasing in the resumption of cancer screening and diagnostics. However, hospitals will have to meet certain criteria before resuming all surgeries. Now, Dr. Moore repeatedly stressed the importance of vaccines and getting booster shots. He also outlined who could get Paxlovid. That's the new antiviral drug. It will go mainly to older, unvaccinated positive patients and immune-compromised who are also positive. As for mask mandates, well, Dr. Moore says he hopes, and note the word hopes, that COVID will not be as prevalent in the community by April, and he hopes, just maybe, mask policies could be lifted in May. There's always a caveat, though. It all depends on variants.